Over the past year, North Lincolnshire CCG has been working hard to improve local NHS services. Here are a few of our highlights from this year. It's been a year like no other. Since the first coronavirus case in our hospitals in March 2020, NHS staff have cared for thousands of seriously ill COVID patients. At the same time, the NHS has rolled out the biggest vaccination programme in our history. Throughout the hard times, the amazing work of our NHS staff, volunteers, care staff and many other key workers has really shone through. Their work has been truly incredible.
It now feels like there are much brighter times ahead for our country, but we'll always remember those who've sadly passed away due to coronavirus, and our thoughts are with their loved ones. The dedication, bravery and tireless commitment of our NHS staff has also meant that many thousands of lives have been saved.
The NHS could not have done all of this without the skill and dedication of our people, and the support of the thousands of volunteers, returners and other key workers who have all been instrumental throughout the whole pandemic.
In December 2020, following a difficult year of restrictions, the NHS began rolling out the coronavirus vaccine.
Slowly they came, some in wheelchairs, some on foot. Thousands of 80 and 90-year-olds, all with one aim, the vaccine.
It's going to make a lot of difference because I haven't been out for weeks.
While most seem to take it in their stride, like Harry and Mary Williams, who were celebrating their 70th wedding anniversary.
In a lot of ways, very excited.
All eagerly waiting for this, the entire team, and the minute I got it, I made sure everything was okay. I was a bit shaky and I informed all my team that we had arrived, the vaccines had arrived, and we were very excited.
Across England, GPs had raised concerns over a lower uptake of coronavirus vaccinations among patients from ethnic minority backgrounds, warning that misinformation had left some patients reluctant to come forward. Local health and care organisations across our area came together to target specific communities, religious groups and distribute vaccine information in several different languages.
मेरा नाम सतपाल सिंह है। इस वैक्सीन में कोई भी पशु का अंश कि वैक्सीन्स बहुत सेफ ने ते बहुत वधिया ने।
Many languages, but one message.
Efektywną I bezpieczną.
और मुझे कोरोना वायरस की वैक्सीन
Videos by doctors in Gujarati, Urdu, Punjabi, Polish, Hindi and English, telling people to trust the scientists when they say COVID vaccines are safe. Pounding the pavements in Scunthorpe's town ward, where almost a fifth of people entitled to the jab still haven't taken up the offer. So leaflets in 4 languages are being delivered, and medical staff are persuading people to make appointments.
A lot of the areas around here, people work in different jobs, there's deprivation factor, so the hours are antisocial, they're difficult to find time to go and have clinics. Just making them aware that there are clinics running outside work hours, on weekends, and all that will improve the uptake.
Yeah, well, there's been a load of rumours on internet, hasn't there?
And I think that's what we're trying to battle against, that there's a lot of misinformation.
And this is one way they're tackling that. It's the latest idea following others like a pop-up vaccine centre at Scunthorpe's Sikh complex and another at one of the town's mosques.
We wanted to have a conversation on a Friday prayer, so the doctors came in, they did like an awareness session. We stemmed like a really good interest, so we thought we'll have a clinic.
I have to go out all the time, I have to meet my colleagues, and yeah, I've got a little one in my home, so yeah, I have to protect her.
This is for my protection and for the people or my family protection.
Here at this food processing site, they're making sure everyone has access to the vaccine.
We've got a large Eastern European migrant workforce. Some of our workers, we know that they don't have GPs, and therefore we felt a corporate responsibility, not just for our workers here, but also for the local community, to make sure that people are being vaccinated.
And translators are on hand to help anyone that needs it.
In March, alongside North Lincolnshire Council and our GP Federation, Safecare Network, we launched North Lincolnshire's COVID vaccination site at the Baths Hall in Scunthorpe.
We're here at the Baths Hall in Scunthorpe. We are really excited to be here on launch day. I wanted to say a huge thank you to all of the volunteers, our GP colleagues, but thank you also to all of the staff, the nurses, the pharmacists, the admin staff. We have the army here at the moment. Thank you to everybody to make this possible today.
In November 2020, our CCG was rated good under NHS England and NHS Improvement's NHS Oversight Framework for 2019-20. Together, our CCG staff, local health professionals and partners always strive to do the best for our population by developing local health and care services. We all know that this year has been particularly challenging due to the ongoing effects of the pandemic. This excellent feedback that we have received from NHS England and Improvement is testament to the hard work, commitment and collaborative working of staff and key partners in North Lincolnshire. I would like to say a huge thank you to everyone involved. This is a fantastic achievement.
In November 2020, details of our electronic palliative care system were shared nationally as best practice.
Patients at the end of their life are looked after by many different teams. All these different teams use different computer programs, and thus there has always traditionally been an issue with regards to providing continuity of care with continuity of information from one organisation to another. We introduced the electronic patient care and coordination system. This clever piece of technology allows a single point of access so that patients who are at the end of their life can ensure that their preferences are continued throughout all the different organisations that provide them care. These preferences include patients' wishes for place of care, place of death, whether they want to be resuscitated, and who their carers are, so that their wishes are respected. This innovative IT solution has been recognised as best practice and has been published nationally as an NHS blueprint so that we can share our experience with the rest of the country. It ensures that the patient's preferences are respected, it offers support to the patients, the carers, and ensures continuity of all the carers involved in the patient's care, something that up till now was not possible.
The pandemic has presented an exceptionally challenging time for us all. The effects of social distancing, lockdown, and the loss of loved ones can all take a huge toll on our mental health and well-being. We have been working alongside local mental health providers and charities to ensure our population has access to the right support. A free online mental health and emotional well-being support service was launched to help children and young people living in North Lincolnshire. People aged between 11 and 25 can register to use Kooth, an anonymous online counselling and emotional well-being support service which can be accessed using a computer, smartphone or tablet device. Through Kooth, children and young people can register to receive one-on-one online sessions with qualified counsellors, receive and provide peer-to-peer support through moderated online forums, and read and contribute to articles. Alongside the mental health charity Mind, we launched The Haven, an initiative to provide late-night support and safety for people with mental health problems in Scunthorpe. Lung patients in North Lincolnshire were the first in the UK to benefit from a pioneering virtual reality pulmonary rehabilitation programme. The programme was named a finalist in this year's HSJ Value Awards in the Respiratory Care Initiative of the Year category, as well as winning the regional award at this year's NHS Parliamentary Awards. For more information about your local NHS, please visit www.northlincolnshireccg.nhs.uk.